comes as nurses who work at San Francisco General, Laguna Honda, and community clinics are calling on the city health officials to address their staffing and safety concerns. Jose Martinez has more.
Dozens of registered nurses showed up right here at the Department of Public Health to say enough is enough. They say they've been sounding the alarm for months about severe staffing issues that could lead to a major strike.
Heather Bollinger, a nurse with over 16 years of experience at SF General Hospital, stood alongside dozens of her colleagues at the Department of Public Health to raise urgent issues plaguing the city's healthcare facilities.
We're trying to alert them to some of the consistent staffing concerns and the safety concerns and the lack of resources that are leading to really unsustainable patient care conditions at the hospital.
Megan Green, another nurse at SF General Hospital since 2013, echoed Bollinger's sentiments, expressing deep concern over the worsening situation.
I have frequently worked 12.5 hours without a break, and I can tell you, as I've gotten 16,000 steps in a shift, that is a lot to do with no sitting down and handing your phone to someone so you can just go to the bathroom in peace.
They say these concerns have been ongoing for months across various healthcare facilities, including SF General Hospital, Laguna Honda Hospital, and community clinics. According to a recent survey by the union representing these nurses, 99% of respondents reported having been abused or assaulted at work, with over 70% reporting physical assault, over 94% verbal abuse, and 10% sexual assault and or harassment involving physical interaction.
I've seen an incredibly high turnover rate amongst my colleagues, so that you're constantly working with new people all of the time.
In response to these allegations, the Department of Public Health issued a statement acknowledging the challenges faced by nurses while emphasizing efforts to address staffing issues. They highlighted progress in hiring and retaining permanent registered nurses, citing the addition of 135 new nursing positions since 2019 and a reduction in the RN vacancy rate to just under 8%. In a statement, they said, while the priority is to fill permanent registered nurse positions, we must also rely on contracted nurses when necessary to ensure safe patient care. The use of contracted nurses currently represents just 4% of nursing care provided. However, nurses like Bollinger and Green remain skeptical. With the looming threat of a strike authorization vote, they urge DPH management to pay attention.
And that if they force us to strike, if they put us into a position and back us into a corner where they don't respond to 60 of our proposals and tell us that we're doing fine and that we should just sit down and shut up, then you'll see a strike.
And ultimately, they all agree on one thing. It's time for the department to start taking their complaints seriously.